Welcome to the all viewers and well-wishers of the world. The purpose of my lecture is learn the knowledge from the word, return the knowledge to the word. Motto of my life is learn, earn and return. I have learned a lot, earned a lot. Now it's a time to return a lot to the word. The topic of today is nosocomial infection. Nosocomial infection is the hospital are the places where the people are cured, and hospitals are also transmitters of the disease. Hospital never free of the microorganism, and hospital acquired infection or nosocomial infections are infections that occur during hospitalization or the other healthcare facility in which the patient is admitted, like nursing home, rehabilitation rooms, outpatient clinic, diagnostic laboratory, or other clinical settings. The infections are not present upon hospital admission and do occur when the patient is in the hospital after that. So, as one can see, the hospitals are full of the different kind of the bacteria and the fungi which are present in the atmosphere of the hospital and the different parts of the hospital. Now, nosocomial infection, the Greek nosocomio cause means hospital and sometimes instead called a healthcare associated infection, and other is community acquired infection which one get outside the hospital in the community, so that is called community acquired infection, and the hospital acquired infection is when the patient is admitted in the hospital. Any systemic or localized condition that result from an infectious agent or the toxin at the time cutoff of at least 48 hours after admission, it differentiates between hospital and community acquired infection. I have mentioned that when the patient is in hospital, in the next 48 hours, the patient get infection that is called hospital acquired infection. Healthcare staff spread infection, contaminated equipment, bed linens, or the air droplets in the hospital are responsible. Now one can see the nosocomial infection, the chairs, the lawns, the doors, the different parts of the hospital. These are the source of infection. As one can see, the viruses and the bacteria and the fungi in the hospital setup. And here one can see the labeling of these that can be on the pillow, bed, on this anesthesia machine, on the screens of the different machines which are being used in the hospital and in the operation theater. They are all the potential source of spreading infection to the patient who is admitted in the hospital. Now, infection can originate from outside environment, another infected patient, staff of the unknown source. Sometimes microorganisms originate from the patient's own skin microbiota, becoming opportunistic. Usually, these microbiota, as I have given the lecture on that, these are not causing any harm to the patient on which they reside, but whenever they get opportunity, they are able to cause the infection. So these are called opportunistic. After surgery or other procedures, these microbiota break the skin barrier and get into the deeper layers. This infection is still considered nosocomial because it was not present when the patient was admitted in the hospital. Many types display antimicrobial resistance. So, nosocomial infection that is more seen in compromised host and microorganisms in the hospital environment are also responsible for infection, and the chain of the transmission that are lead to the nosocomial infection. Now, epidemiology. The overall incidence of nosocomial infection is about 6.1% to 29.6% in pediatric ICUs. About 1 in 10 of the people admitted to a hospital will contract hospital acquired infection. Most common wards are intensive care units, 5 to 10% in the developed countries, but more in the developing countries where the facilities are not as good as in the developed countries. So there occurs one death every 6 minutes because of the hospital acquired infection or nosocomial infection. Now, types of the infections are hospital acquired pneumonia or ventilator associated pneumonia, VAP, urinary tract infection, gastroenteritis, puerperal fever after the delivery, central line associated bloodstream infection when we give the CVP line to the very serious patient, surgical site wound infections, skin infection, and meningitis. These are the types of infection which are mostly seen in the hospital as nosocomial infection. Here one can see the bloodstream infection, the ventilator associated pneumonia, VAP, and the urinary tract infection, which are very common. And if we go type of infection and the number of infection percentage, bloodstream infection 62.1%, pneumonia 10.3%, urinary tract infection 7%, surgical site infection 10.3%, meningitis 10.3%, and that makes the total. Here one can see the respiratory tract infection about 60%, urinary tract infection 16%, skin infection about 2%, bloodstream infection 6%, surgical site infection 7%, and GIT about 9%. Now, the types of the infection which are seen in nosocomial infection, there are 3 types of infection which are seen in ICU. Number 1, primary endogenous infection, that the patient is having infection inside his body, that is primary. The secondary endogenous infection, that is the microbiota or other bacteria reinvade the body of the patient, so to make the secondary endogenous infection from the patient's own bacteria that is causing the infection, that is secondary endo. The third is the secondary infection, which is from the outside, that is from the hospital gadgets, from the hospital beds, from the nurses, from the other staff. So that is called secondary infection. Primary endogenous infection, patient's own infection. Secondary, which the patient get while in the hospital, and that is the endogenous bacteria of the patient's own. They secondarily invade the body, so that is called secondary endogenous infection. Now, source of infection, from where the infection comes. Number 1, endogenous. Patient's own flora invade the tissue, microbiota normal. I have told you already. Infection introduced during surgery, that is by the surgical instruments. Even the skin of the patient, when is broken, the microbiota of the skin also do invade the body. Now, instrumental manipulation, if these are not properly sterilized, and the nursing procedures, that is also responsible for introducing the infection. Now, exogenous infection which comes outside the hospital, that is another patient coming and giving the infection to the previous patient. Number of the hospital staff, when they are coming to attend the patient, they are also just giving the infection to the patient. Now, dirty environment in the patient, if the sterilization is not proper in the hospital, that is also responsible for spreading the infection. Now, negative mind will never go you a positive life. And it is said by one of my very good friend that be positive even if your blood group is B negative. So negative mind will never give you a positive life. Be positive always. Now, what are the causes of nosocomial infection? Not well developed humoral and cellular immune defense mechanism which allow the bacteria and the microorganism to enter in your body. Breach of the natural mucous membrane and skin barrier defense barriers. Instrumentation with the foreign bodies, endotracheal tubes, intravascular catheters also introduce infection if not properly sterilized. Alteration of the normal flora through antimicrobial pressure, that is, frequent use of empiric antibiotic that also kills the and just change the behavior of the normal microbiota. Overgrowth of the candida species, use of the steroids and unnecessary broad spectrum antibiotics, crowding, suboptimal nurse patient ratio, less nurses for the proper patient caring, and that promote transmission of the nosocomial organism from one infant to another through poor hand washing. Environmental contamination is also responsible. So here one can see a person who is exposed to IV fluid, antiseptics and disinfectants, invasive procedures, prosthetic and catheters and ventilators and the food, the dust and the air. These are all environmental source of the nosocomial infection to which a person or the patient who is admitted in the hospital is exposed. Now, symptoms for the infection, that is discharge, pain or irritation from a wound, fever, cough, shortness of breath, burning with urination or difficulty in urination, headache, nausea, vomiting, diarrhea. Patient experience visible symptom up to 48 hours after hospital admission, which were not present when the patient was not admitted in the hospital, and these symptoms occur up to 3 days after discharge and up to 30 days after an operation. So these are the symptoms of nosocomial infection. Now, here symptoms and signs of the hospital-acquired infection. One can have fever, headache, rashes, severe coughing, and the diarrhea. These are all the different systems which are involved and causing the symptom according to the system involved. Now, predisposing factors, hospital environment heavily laden with pathogens found in air, dust, antiseptic lotions, water and food, patient shedding also responsible for that. Hospital microbes are multi-drug resistant. Instrumentation in the hospital introduce infection, blood products, and the IV fluids transmit infection. Accidental inoculation of the infectious material in the patient body. And agents of the nosocomial infection are gram-positive bacteria like Staph aureus, MRSA, methicillin-resistant Staph aureus, Staph epidermidis, Staph pyogenes, Staph pneumoniae, Clostridium tetani. These bacteria cause about 90% infection. Now, gram-negative like E. coli, Klebsiella, Proteus, Pseudomonas, Acinetobacter, and viruses like hepatitis B, C, D, HIV, cytomegalovirus, herpes and influenza virus, fungi like Aspergillus and the Candida, and the parasite like Entamoeba and the Toxoplasma are responsible for causing these nosocomial infection. Now, Here one can see the agents of the nosocomial infection looks like to be very virulent. These are the viruses, bacteria, and the fungi. Now, trichomes the nosocomial infection that is mostly responsible for most of the infection are Staphylococcus aureus, Escherichia coli, and Pseudomonas aeruginosa. Now, main routes of the transmission of infection to the patient are contact transmission, that is divided into direct contact transmission and indirect contact transmission, then droplet transmission, third is airborne transmission, then common vehicle transmission, number 4, and vector-borne transmission is number 5. And here one can see the droplet coming out from the mouth and the nose of the patient, then waterborne infection, vector-borne by the insects, airborne as one can see when coughing, and that is transmitting to the other, and the direct contact and the indirect contact with the different utensils and the fomites, and then the foodborne. These are all the mode of transmission, and I am going to discuss one by one. Okay. And here is the exogenous infection outside the hospital. The patient is admitted in the hospital, and one can get the infection from the different sources, the sweepers and the nurses when they are coming from the outside and bringing the infection inside. So bacteria from outside and the bacteria from infected patient, as you can see, then contamination from the equipment that is being used, then bacteria from visitors and the hospital person, those who are visiting and attending the patient, then bacteria caused by the insects which are coming and just biting the patient and transmitting the various microorganisms. Now, number 1, contact transmission, most important and frequent mode of transmission. It is divided into 2 parts. Direct contact transmission means a direct body, surface to body, surface contact. That is, one is touching the body part to the others, that is transmitting the direct contact transmission. Physical transfer of the microbes between a susceptible host and an infected colonized person. A person cares and turns a patient, gives bath or other patient care activities in which the patient physically touch, in which the caregiver physically touch the patient and can transmit the microbe from his body to that patient's body. Also can occur between the 2 patients, one carrier and the other susceptible host, so that can transfer the patient to the other patient. Then contact transmission continue, indirect contact transmission. This involves contact of a susceptible host with a contaminated intermediate object that is being used by the patient that has already been contaminated by some other person, and the patient who is admitted in the hospital is going to use that, and that is indirect contact transmission, like contaminated instruments, needles or dressings, or contaminated gloves, improper use of the saline flush, syringes, vials and bags, healthcare worker, touch gloves, disposable needles, and intravenous devices. So they do provide the microorganism there that is being used by the patient. So these are being transmitted by indirect contact transmission. Here one can see the direct infection by these person, contaminated medical staff and visitor. These contact with the patient, so that is direct infection. Here the medical equipment, implants and the devices, other being used, gloves and needles and scissors being used on the patient, and that is indirect infection. And other is also the hospital facilities in which the patient comes in contact, that is also the indirect infection. These person can contaminate these things being used by this patient. Similarly, these person can contaminate these things for responsible for indirect infection.